Good morning. I'm Patricia may Odavar from Pamantasan ng Lungsod ng Muntinlupa and currently studying Bachelor of Science major in Psychology. So here's my topic for today. Depression. Is there a cure for it? It is a very relevant topic and need to be discussed for someone who don't know what is it and what causes it. Let's start in here. What is depression? Does everyone know the definition and the meaning of it? Depression, major depressive disorder, is a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. Fortunately, it is also treatable. Depression causes feelings of sadness and or a loss of interest in activities you once enjoyed. It can lead to a variety of emotional and physical problems and can decrease your ability to function at work and at home. This is where our emotions are very important. Depression symptoms can vary from mild to severe and can include feeling sad or having a depressed mood, loss of interest or pleasure in activities once enjoyed. Example is when you love to hang out with your friends and suddenly you felt out of love doing it. Change in appetite, weight loss or gain unrelated to dieting, trouble sleeping or sleeping too much, insomnia, loss of energy or increased fatigue, increase in purposeless physical activity, inability to sit still, pacing, hand wringing, or slowed movements or speech. This action must be severe enough to be observed by others. Feeling worthless or guilty. Difficulty thinking, concentrating or making decisions. Thoughts of death or suicide. This is a major effect of having a depression. Is depression different from sadness or grief or bereavement? The death of a loved one, loss of a job, or the ending of a relationship are difficult experiences for a person to endure. It is normal for feelings of sadness or grief to develop in response to such situations. Those experiencing loss often might describe themselves as being depressed. But being sad is not the same as having depression. The grieving process is natural and unique of each individual and shares some of the same features of depressions. Both grief and depression may include intense sadness and withdrawal from usual activities. They are also different in important ways. In grief, painful feelings come in the waves, often intermixed with positive memories of the deceased. In major depression, mood and or interest, pleasure are decreased for most of 2 weeks. In grief, self-esteem is usually maintained. In major depression, feelings of worthlessness and self-loathing are common. In grief, thoughts of death may surface when thinking of fantasizing about joining the deceased loved one. In major depression, thoughts are focused on ending one's life due to feeling worthless or undeserving of living or being unable to cope with the pain of depression. Risk factor of depression. Several factors can play in a role in depression. Biochemistry. Differences in certain chemicals in the brain may contribute to symptoms of depression. Genetics. Depression can run in families. For example, if one identical twin has depression and the other has a 70% chance of having the illness sometime in life. Personality. People with low self-esteem who are easily overwhelmed by stress or who are generally pessimistic appear to be more likely to experience depression. Environmental factors. Continuous exposure to violence, neglect, abuse, or Poverty may make some people more vulnerable to depression. How is depression treated? Depression is almost the most treatable of mental disorders. Between 80% and 90% of people with depression eventually respond well to treatment. Almost all patients gain some relief from their symptoms. Before a diagnosis or treatment, a health professional should conduct a thorough diagnostic evaluation, including an interview and a physical examination. In some cases, a blood test might be done to make sure that depression is not due to a medical condition like a thyroid problem or a vitamin deficiency. Reversing the medical cause would alleviate the depression-like symptoms. The definition, the evaluation, will identify specific symptoms and explore medical and family histories as well as cultural and environmental factors with the goal of arriving at a diagnosis and planning a course of action. Medication. Brain chemistry may contribute to an individual's depression and may factor into their treatment. For this reason, antidepressants might be prescribed to help modify one's brain chemistry. These medications are not sedatives, uppers, or tranquilizers. They are not habit-forming. Generally, antidepressant medications have no stimulating effect on people not experiencing depression. Antidepressant may produce some improvement within the first week or two of use, yet full benefits may not be seen for 2 to 3 months. If a patient feels little or no improvement after several weeks, his or her psychiatrist can alter the dose of the medication or add or substitute another antidepressant. In some situations, from psychotropic medication may be helpful. It is important to let your doctor know if a medication does not work or if you experience side effects. Psychiatrists usually recommend that patients continue to take medication for 6 or more months after the symptoms have improved. Longer-term maintenance treatment may be suggested to decrease the risk of future episodes for certain people at high risk. Psychotherapy. Psychotherapy or talk therapy is sometimes used alone for treatment of mild depression for moderate to severe depression. Psychotherapy is often used along with antidepressant medications. Cognitive behavioral therapy, CBT, has been found to be effective in treating depression. CBT is a form of therapy focused on the problem solving in the present. CBT helps a person to recognize distorted or negative thinking with a goal of changing thoughts and behaviors to respond to challenges in a more positive manner. Psychotherapy may include only the individual, but it can include others. For example, family or couples therapy can help address issues within these close relationships. Group therapy brings people with similar illnesses together in a supportive environment and can assist the participant to learn how others cope in similar situations. Electroconvulsive therapy, ECT, is a medical treatment that has been most commonly reserved for patients with severe major depression who have not responded to other treatment. It involves a brief electrical stimulation of the brain while the patient is under anesthesia. A patient typically receives ECT 2 or 3 times a week for a total of 6 to 12 treatments. It is usually managed by a team of trained medical professionals, including a psychiatrist, an anesthesiologist, and a nurse or physician assistant. ECT has been used since the 1940s, and many years of research have led to major improvements and the recognition of its effectiveness as the mainstream rather than a last resort treatment. Self-help coping. There are a number of things people can do to help reduce the symptoms of depression. For many people, regular exercise helps create positive feeling and improves mood. Getting enough quality sleep on a regular basis, eating a healthy diet, and avoiding alcohol, a depressant, can also help reduce symptoms of depression. Depression is a real illness and help is available. With proper diagnosis and treatment, the vast majority of people with depression will overcome it. If you are experiencing symptoms of depression, a first step is to see your family physician or psychiatrist. Talk about your concerns and request a thorough evaluation. This is a start to addressing your mental health needs. If you feel the symptoms of today's topic, you can talk to me to help you out of this depression. Do I feel this depression too? Yes. When my grades are low, financial problem, and misunderstanding in some ways. Everyone can experience this, but we can overcome it by telling ourselves that nothing can lose if we fight it. Self-love is the effective medication for it. Again, good morning. This is Patricia May Odavar. Thank you for listening. Thank you.